Dementia risk factors. Dementia is a broad category of brain diseases that cause a long-term and often gradual decrease in the ability to think and remember that is severe enough to affect a person's daily functioning. Though dementia generally refers to problems with mental abilities and memory, it can also affect other brain functions. It is a progressive disease, meaning it gets worse over time. Dementia is not a normal part of aging. It is a severe condition that can lead to death. There are many different types of dementia, each with its cause. The most common type of dementia is Alzheimer's disease. Other types include Lewy body dementia, frontotemporal dementia, and vascular dementia. There are several risk factors for dementia. These include age, family history, and lifestyle choices. In this video, we will explore the risk factors for dementia and what you can do to reduce your risk of dementia. So watch to the end, and if you haven't liked the video yet, be sure to like it and subscribe to our channel so you don't miss any further videos. Some of the most common dementia risk factors include hypertension. Hypertension, also known as high blood pressure, is the most common dementia risk factor. It is a major cause of stroke and contributes to cognitive decline. A recent study found that some people with hypertension were more likely to develop dementia than those who did not have hypertension. This was true even after adjusting for other factors such as age, sex, ethnicity, and education level. The study's authors say that hypertension may damage the brain in several ways, including causing inflammation, reducing blood flow to the brain, and damaging the blood vessels. If you have hypertension, it's important to control it with medication and lifestyle changes. This can help reduce your risk of dementia and other neurological conditions. Number 2. Family history. A recent study has found that family history is a common risk factor for dementia. The study found that people with a family history of dementia were more likely to develop the condition themselves. This was especially true for people with a first-degree relatives, such as a parent or sibling, who had dementia. While the exact cause of dementia is still unknown, this study provides more evidence that it is a disease that runs in families. If you have a family history of dementia, it is important to be aware of the risk and to talk to your doctor about any concerns you may have. Number 3. Previous head injuries. There is a growing evidence that previous head injuries are a common risk factor for dementia. This is especially true for those who have sustained multiple head injuries or concussion-like injuries. While the exact mechanisms are still not fully understood, it is thought that head injuries can cause long-term damage to the brain that leads to dementia. This is why it's important to take precautions to avoid head injuries, especially if you already had one in the past. If you are concerned about your risk of dementia, talk to your doctor about your head injury history and what you can do to reduce your risk. Number 4. Increase alcohol consumption. Alcohol-related dementia is a progressive brain disorder that is caused by heavy drinking over a long period. This type of dementia can lead to memory problems, confusion, and difficulty with everyday tasks. While there is no cure for dementia, there are ways to treat the symptoms and slow its progression. If you or someone you know is struggling with alcohol-related dementia, it is important to seek help from a medical professional. There are also many support groups and resources available to help people cope with this condition. Number 5. Depression and anxiety. A recent study has shown that people who suffer from depression and anxiety are at a greater risk of developing dementia later in life. The study, which was conducted by a team of international researchers, looked at data from over 6 million people. The findings are significant because they suggest that depression and anxiety may be early warning signs of dementia. This means that if we can treat these conditions early, we may be able to prevent or delay the onset of dementia. The study is still in its early stages and more research is needed to confirm the findings. However, the results are promising and offer a new way of thinking about how we can protect our brain health as we age. Number 6. Age. Age is the most common risk factor for dementia. The chance of developing dementia increases with age, and the majority of people with dementia are 65 years of age or older. While dementia can occur in people as young as 40, it is very rare in people under the age of 65. There are several other risk factors for dementia, including certain medical conditions, certain lifestyle factors, and family history. However, age is the biggest risk factor, and the risk of developing dementia increases with age. Number 7. Poor nutrition. Dementia is a debilitating condition that causes a decline in cognitive function. While there are many risk factors for dementia, one of the most common is poor nutrition. A diet that is high in unhealthy fats and sugars can help to promote dementia, while a healthy diet that includes plenty of fruits, vegetables, and whole grains can help to prevent it. If you are concerned about your risk for dementia, be sure to talk to your doctor about your diet and whether it could be contributing to your cognitive decline. Making changes to your diet may not only help to improve your cognitive function, but it can also help to improve your overall health. Number 8. Social isolation. Social isolation is also a common risk factor for dementia. Dementia is a broad term used to describe a decline in mental ability due to disease or injury. It can cause memory loss, problems with thinking, and changes in mood and behavior. Isolation can increase the risk of dementia by affecting a person's mental and physical health. It can also lead to social and economic problems, which can further increase the risk of dementia. There are many ways to reduce the risk of social isolation, such as staying connected with friends and family, getting involved in activities and clubs, and volunteering. Number 9. Race and ethnicity. A recent study has found that race and ethnicity are common risk factors for dementia. The study, which was published in the journal Neurology, looked at data from over 6,000 people with dementia and found that African Americans and Hispanics are more likely to develop the condition than whites. This is just one study, but it highlights the importance of considering race and ethnicity when studying dementia. Scientists still have a lot to learn about the disease, and this new finding can help them to better understand how it develops and how to treat it. Number 10. Education. It has been increasingly recognized that education is a risk factor for dementia. A growing body of evidence suggests that individuals with higher level of education are less likely to develop dementia than those with lower levels of education. This relationship is thought to be due to the cognitive reserve that is built up over a lifetime of learning. While the exact mechanisms are still not fully understood, it is clear that education plays a role in protecting against dementia. This is just one more reason to prioritize education and lifelong learning. Number 11. Diabetes. While the exact cause of dementia is still unknown, studies have shown that certain risk factors can increase your chances of developing the condition. One of these risk factors is diabetes. People with diabetes have a higher risk of developing dementia because the disease can damage the blood vessels in the brain. This damage can lead to problems with memory, thinking, and coordination. If you have diabetes, it is important to work with your doctor to manage the condition and keep your risk of dementia as low as possible. There are many treatments available that can help you stay healthy and live a long and productive life. Number 12. Obesity. It is well known that obesity is a risk factor for many health conditions, including heart disease, stroke, and diabetes. But did you know that obesity also increases your risk for dementia? Studies have shown that people who are obese are more likely to develop dementia than those of a healthy weight. One reason for this is that obesity can lead to insulin resistance, which has been linked to dementia. Obesity is also a risk factor for other conditions that can contribute to cognitive declines, such as cardiovascular disease and inflammation. If you are obese, it is important to take steps to lose weight and improve your health. This may not only reduce your risk for dementia, but also for other conditions that can negatively impact your quality of life. Number 13. Lack of exercise. Exercise has long been known to have numerous health benefits, both for the body and the mind. However, new research is now showing that lack of exercise may be a risk factor for dementia. This is a significant finding, as it means that we may be able to prevent dementia by simply encouraging people to be more active. This is something that can be done at any age, and it may even be possible to reverse the effects of dementia with exercise. More research is needed to confirm these findings, but it is clear that an exercise is a powerful tool that can be used to protect the brain from decline. Number 14. High cholesterol. It's long been known that high cholesterol is a risk factor for heart disease, but recent research has also shown that high cholesterol may be a risk factor for dementia. Dementia is a brain disorder that causes problems with memory, thinking, and behavior. It can be accompanied by changes in mood and personality. Alzheimer's disease is a most common type of dementia. While the link between high cholesterol and dementia is not yet fully understood, scientists believe that cholesterol may cause inflammation in the brain, which can lead to cognitive decline. If you have high cholesterol, it is important to talk to your doctor about ways to lower your risk for dementia. There are lifestyle changes you can make, such as eating a healthy diet and exercising regularly. This can help lower your cholesterol. You may also need to take medication to lower your cholesterol. Number 15. Smoking. Smoking is a well-known risk factor for many health conditions, including heart disease, stroke, and cancer. But did you know that smoking is also a risk factor for dementia? Studies have shown that smokers are more likely to develop dementia than non-smokers. The risk is even greater for people who smoke heavily or who have smoked for a long time. If you currently smoke, quitting is the best thing you can do for your health. If you're concerned about your risk of developing dementia, talk to your doctor. They can help you assess your risk and make a plan to quit smoking if needed. Some of these factors are out of our control. There are things that we can do to reduce our risks, such as staying physically and mentally active, eating a healthy diet, and socializing regularly. If you enjoyed the video, be sure to like and subscribe to our channel so you don't miss any future videos. And what are your thoughts on dementia risk factors? Let us know in the comments section below. Thanks for watching.